Welcome to the Getting Started with Duet program. This brief presentation will introduce you to the diagnostic fitting process for Duet HD and Duet Multifocal. Hi, I'm Dr. Jim Kirchner. I'm Senior Vice President of Clinical and Professional Services at Synergize. Prior to joining Synergize, I founded and spent the majority of my career in a multi-doctor, multi-location private practice in Lincoln, Nebraska. I saw firsthand how the Duet family of lenses gave my patients the best possible vision while helping to differentiate my practice and build a recurring revenue stream. I'm excited to share this information with you today. So let's get started. Before we walk through the fitting process, let's talk briefly about how you and your staff might identify patients in your practice that would benefit from Duet lenses. Let's start with Duet HD. Many of our successful fitters assess both their patients' visual requirements and their satisfaction with their current modality to uncover a need for Duet. Those patients who need a precise visual acuity for their work or hobbies, patients who do a lot of night driving, and those astigmats who frequently shift their gaze will all be thrilled with the exceptional vision delivered by Duet HD. Current contact lens wearers who notice blurry vision at the end of their day, when they shift their vision or lie down, or when they're driving at night, all are excellent candidates for Duet HD. And look for those patients who rate their vision as less than an 8 on a scale of 1 to 10. They'll be pleased to know there's an option for better vision. And of course, those patients who come in asking you what's new will be excited to hear about the latest contact lens technology from you rather than hearing about it elsewhere. Let's now shift to Duet Multifocal. Reach for this lens for those patients who need steady, clear, near vision for their work or hobbies, patients who do a lot of reading or computer work, and people whose job or hobbies require a combination of clear, near, intermediate, and distance vision. Another way to find patients for Duet Multifocal is to look for people who are dissatisfied with their current correction. Think of your patients in glasses who would like to wear contact lenses, but they've been told they can't because of their astigmatism. Patients wearing readers over contacts are also great candidates for Duet Multifocal because of the exceptional near vision this lens delivers. And current multifocal wearers who would like better vision at all distances will be thrilled with Duet Multifocal. The key is to ask the questions that give you a true picture of the patient's vision needs. Whether they're astigmatic, presbyopic, or both, you can improve their vision and make them happier with the Duet family of lenses. Let's now talk about the fitting philosophy and methodology for the Duet family of lenses. Fitting Duet lenses is as easy as fitting soft lenses. In fact, once you've determined the RGP base curve, the rest of the fitting process is identical to fitting a soft lens. The lens fit is determined by the soft skirt, which is assessed based on comfort and movement. Unlike past products with Synergize, there's no need to use fluorescein during the initial lens fit. As with any contact lens, you may find the need for fluorescein at the follow-up visit, but it is not necessary to assess the initial lens fit. This streamlined fitting approach results in positive outcomes, happy patients, and long-term success rates. The first step in the diagnostic fitting process is to select the RGP base curve. Our goal in selecting the base curve is to produce a close to alignment fit in relation to the flattest K, with a minimal plus tear lens being created. Now remember, the tear lens equals the RGP base curve in diopters minus the flattest K in diopters. The Duet fitting strategy creates a tear lens that will always be a plus tear lens. To keep the fit close to alignment, you'll select the base curve that is closely aligned, but less than a diopter and a half steeper than the flattest K. The chart on the right-hand side of the screen shows the available Duet base curves in millimeters as well as diopters. This chart will be included in your fitting materials to make it easy to determine which base curve you'll need. If two base curves meet the criteria of less than a diopter and a half steeper than the flattest K, choose the flatter of the two base curves. Now that you've selected the base curve, the rest of the fit is determined by the lens skirt. The ultimate goal is to fit the flattest skirt possible. This allows for freer movement and enhanced tear exchange. We found that the quickest way to determine the appropriate skirt curve is to start with a medium skirt in one eye and a flat skirt in the other. This allows you to quickly compare the two skirt curves and choose the one that provides the best movement, centration, and tear exchange. If you're fitting a Duet multifocal lens, you'll need to choose a zone size as well. Initially, you'll want to start with a small zone in one eye and a large zone in the other eye. The mixed zone strategy allows the binocular visual system to fully utilize both zone profiles for the maximum optical effect. You may consider eye dominance when choosing which eye gets the small zone and which eye gets the large zone, but it isn't necessary. Clinically, eye dominance does not drive the choice of which eye gets the small zone. Now that you've selected your initial parameters, you're ready to insert the lenses. Be sure to fill the bowl of the lens completely with solution before insertion, and then allow the lenses to settle on the patient's eye for at least 10 minutes to up to 30 minutes. You can move the patient out of the exam lane and allow them to sit for a length of time that works best for your practice flow. I want to give you a few quick tips for inserting Duet lenses when you're doing a diagnostic fit. First, the lens inserter makes insertion quick and easy for you and your staff. You'll want to teach your patients to insert the lenses without the inserter, but when you're doing it in your office, using the inserter makes the process much faster. Insertion is easiest when you hold the patient's upper lid and the patient holds their lower lid. And it's always a good idea to practice lens insertion a couple times on a staff member or your Duet representative prior to your first patient fit. Now that the lens has had a chance to settle, you're ready to assess the fit. Remember that we're using movement and comfort to determine the appropriate lens fit, and the goal is to choose the flattest skirt that provides good movement and comfort. When you look at the lens in the slit lamp, you want to see about 1 millimeter of movement on straight ahead and upward gaze after a full blink. You also want to make sure that the lens is centering properly and that there is no wrinkling at the skirt edge. If you see wrinkling, you'll know you'll need a steeper skirt. You also want to assess patient comfort. Now keep in mind at this stage there might be a little more awareness of the flatter skirt compared to the steeper skirt. Lens awareness is completely acceptable because comfort will improve as the patient adapts to the lenses. It's important to differentiate between discomfort and mild awareness because you don't want the patient in the flatter skirt if it's truly uncomfortable. Once you've determined which skirt provides the best fit, you can simply order that skirt for both eyes. You don't need to try the selected skirt on the other eye. Once you've determined the right lens fit, you're ready to do a distance over refraction. When you do your over refraction, you'll want to use the over plus refractive method to avoid over minusing. That's the biggest error that I see my colleagues make when fitting Duet lenses, because it's so easy to over minus the prescription when refracting over the aspheric RGP button, especially if you're fitting the multifocal. Once you've reached the endpoint of your over refraction, you should have a final lens power that is up to a diopter and a half more minus than the spherical portion of the spectacle refraction. This is due to the plus tier lens that you've created under the RGP base curve. Let's look at an example. If you have a patient with a spectacle refraction of -2, -1.5 axis 90, you would expect the final Duet lens power to be between -2.5 and -3.5. Notice that I've highlighted and crossed off the astigmatic portion of the spectacle correction. That's because the RGP center button cancels corneal astigmatism, so all you have to be concerned about is the spherical power of the refraction. If the final lens power is more than a diopter and a half more minus than the spherical power of the spectacle refraction, you need to order a flatter base curve. Now, if you can't get good, crisp vision or reach a clear endpoint of refraction, there are a couple things that you can do. First of all, if you're fitting Duet multifocal, you may need to change the zone size. If near vision is poor, replace the small zone with large zones. And if distance vision is unacceptable, replace the large zone with a small zone. And whether you're fitting Duet multifocal or Duet HD, remember to be aware of the possible residual astigmatism, which can cause blur. Duet lenses are not designed to correct lenticular astigmatism, so if you're seeing residual astigmatism, the patient may not be an ideal candidate for the lens. At this point, you're done. You can order the lenses in selected parameters. Just be sure to adjust for the vertex distance if the lens power is greater than ±4. We also have an empirical ordering option if you prefer to skip the diagnostic fitting process. You can place an empirical order by calling our consultation team with the patient's Ks, refraction, and add power if it's a Duet multifocal patient. Let's now talk briefly about the dispensing visit. It's important to set appropriate patient expectations, especially when you're fitting multifocal patients. Let your patients know that they may experience an adaptation to the feel of the lens. Lens awareness may last up to a week, with awareness decreasing over that time. If you have a Duet multifocal patient, they'll also need to adapt in the simultaneous optics that the lens delivers. Occasionally, printed words may appear to come off the page, or your patients may notice shadows around objects at near. This typically goes away within the first week or two of wear as the visual system adapts to the optic design of the lenses. You may want to recommend a tiered but aggressive increase in wear time for the first 7 days. And let your patients know that insertion removal takes a little practice, but it's a skill that they'll quickly master. Now that you've completed the diagnostic fitting process, it's important to have a staff member thoroughly train your patients on insertion removal and lens care. We have videos available for your patients and your staff at duetcontacts.com, so be sure to use those resources to set your patient up for success. And when you're recommending a lens care system, use solutions that are approved for use with silicone hydrogel lenses. Our testing has shown that the best solutions to use with Duet lenses are ClearCare Peroxide System, BioTrue, and Aquify. This concludes the diagnostic fitting process module. We appreciate your time and attention. You may now wish to move on to the Tips for Success module. Thank you again for your time and interest in fitting Duet lenses.